Yeah, I'm at the computer looking over the patient's chart, specifically regarding the wound care. Got that all set. I'm gonna go ahead and grab my supplies. Got my supplies, head into the room, got it on my table. I am going to perform hand hygiene, put gloves on, put on the proper PPE, and then I am going to check to make sure that this is Mrs. Smith. Check her ID, Mrs. Smith. Perfect. How you feeling today? Good. Nope. We do not have any pain medication for you. Doctor has not ordered anything. I do you have Tylenol? No? No Tylenol? Okay. No Tylenol then. Alright, you're ready to go? Cool. I am going to be changing your wound dressing. Looking back into the chart, it's about time, so we need to get a new sterile dressing on there for you. And then go ahead and dispose this. Yeah. Just like right about, there we go, perfect. Is that okay? Good. All right, and then I am going to remove the dressing starting from the corner. Be careful not to rub off any hair with the push-pull method. Don't want to see Marcy. I don't want to tear my patient's skin from removing the tape. And then now I'm going to be assessing for the presence, the amount, type, color, and odor of this dressing. Then I will dispose of that. And then now looking at the wound, I'm going to be looking for approximation, dehiscence. The wound is sutured up, so it is closed. Any redness, swelling, bruising. And then I am going to remove my gloves. And I am going to go ahead and get my tape first. Getting 5 pieces of tape. I'm going to be labeling the 5th one with my initials, the date, and the time. Then I'm going to start setting up my sterile field, starting with the drape. Got about a 1-inch border that I can touch. Side down. Then I am going to open up my gauze 6 inches above the table, opening it away from me. And dispose of this. Open up my abdominal pad, once again 6 inches above the table, away from me. Dispose of this. Then now I am going to put on my sterile gloves. course, would perform proper hand hygiene before putting on these sterile gloves. Make sure to cover the cuff of the gown. Now I'm going to place the gauze on Mrs. Smith. And the abdominal pad, the blue line, facing away from the patient. And now I will be breaking the sterile field to touch the tape. Place the one on the label right on top. We can see it. How's that? Is that okay? Alright, I'm going to cover the patient back up. Lower my bed back down. Make sure the patient is in the lowest position, nice and comfortable. Then I'm going to make sure I check this wound dressing at least once every shift. If it's more complex dressing, then as many times as necessary. And then properly remove of my PPE and hand hygiene.